Scoliosis is a three-dimensional deformity of the spine with the torsion of the vertebrae and lateral deviation of the spine from the normal. So this can cause spinal as well as truncal imbalance. If this cause occurs in a very younger age, say in the childhood, because more growth is left when the chest cavity, the pelvic cavity, everything develops, the space for the internal organs become very less. So if the curves exceed more than 100 to 120 degrees in the adulthood, they can go for cardiopulmonary failure. And smaller curves, they can go for early osteoarthritis of the spine because of the torsion of the vertebrae, leading to persistent back pain. So these curves require early treatment. The problems in childhood or in the teenage, because the common curve seen in our area is idiopathic scoliosis, meaning there is no definite reason identified so far. Even though congenital as well as neuromuscular variety of scoliosis are also seen in our area, idiopathic scoliosis outrank the other varieties much more. So this is seen in girls more than males, more than boys. So the cosmetic deformity and the pressure from the peer group is immense on these children. That can even affect their studies, their mental status, everything. So it is utmost importance to correct these curves at an earlier stage before they become a very severe curve. So we correct those curves more than 40 degrees or with those with truncal or spinal imbalance surgically. The surgery involves correction of these curves using nuts, bolts, screws, wires, hooks, etc. These implants are used to correct the deformity in a safer limit, and the main part is the fusion of the instrumented vertebrae. The segments between in the curve will be fused so that it doesn't progress further, and the correction what we obtained will be maintained. So the truncal and the shoulder and the spinal balance, everything will be maintained. The cosmetically the child will be balanced, preventing early osteoarthrosis and truncal and spinal balance, and their mental status also will be improved. So it should be done. So the treatment for these curves should be done at an early age when it is indicated.